To the Gold Room of the Capitol. It's great to see so many of you here. Let me begin by thanking the media who is joining us here today. We so appreciate you and the incredible work that you have done over the past 2 years to help us get good information to the people of Utah. It's been a remarkable 2 years, an interesting 2 years, a terrible 2 years in so many ways. But you have been with us every step of the way, and we could not have gotten through this pandemic without you. Literally, lives have been saved because of the information that you have been able to deliver to the people of Utah. Reliable information, and we appreciate that partnership. It was almost 2 years ago today that many of us gathered together in the Emergency Operations Center downstairs, a couple floors from where we are standing now, to announce the state's first case of COVID-19. We've since announced an additional 915,000 plus cases. We've conducted more than 9.1 million tests. We've administered more than 4.9 million doses of COVID-19 vaccines. And tragically, we have lost more than 4,300 of our fellow Utahn residents. These are friends, neighbors, and family members. Many still deal with the effects of long COVID. We've closed schools and safely reopened them, one of the first in the country to do so. We've masked up and socially distanced. We've stockpiled hand sanitizer and Clorox wipes and toilet paper. We've quarantined and isolated. We've worked from home. We've Zoomed and DoorDashed. There's almost nothing in our daily lives that hasn't experienced at least some sort of change over the past 2 years. But we've also come a long way. And today we are in a much different place than we were 2 years ago, a much better place. We have tools today that we did not have 2 years ago. We have ample testing. We have vaccines. In fact, we have tools today that we didn't have 2 months ago, including widespread home tests and antiviral pills. And it's time for our state's response to the pandemic to make the appropriate shift to better match where we are today. It's time to adapt. All of the key metrics are moving in the right direction. Vaccines are widely available. Uptake continues. And hopefully soon, everyone older than 6 months will be eligible to receive the vaccine. Treatments are more widely available and supplies are improving every week. Testing is available now in the comfort of your own home. Hospitals and ICUs and the healthcare workers who staff them are still at high levels as they trail behind other indicators, but they too are finally seeing significant relief as we've reduced hospitalizations by more than 200 just over the past couple weeks. It is now time to transition out of an emergency posture and into a manageable risk model. By March 31st, our response will transition to what we are calling a steady state. Our Department of Health will spend the next 6 weeks refining plans they've already started to develop to help us get there. Our response will look different, and that's okay. It's a good thing. Some elements of the response, like testing and treatment, will transition to being the responsibility of our highly capable healthcare systems. This will allow our public health system to refocus on the elements of the response that a public health system would normally look after: disease surveillance, data collection and reporting, vaccinations, and public awareness. Now, let me be clear that this is not the end of COVID, but it is the end, or rather the beginning, of treating COVID as we do other seasonal respiratory viruses. As the state, we are not packing up and heading home. We will continue to see cases and outbreaks and hospitalizations and, unfortunately, deaths. But it does mean that we are adapting how we respond to these things. There is still work to be done. How we accomplish that work is going to look different. And as we have noted many times, the tools don't work if they are not used. So until more people get vaccinated and boosted, we will continue to be ready to adjust and respond. As we move into a more personal risk model, I think it's important to note that we as human beings will all have to decide what that risk variance is for us. There are a whole bunch of people who are unvaccinated and unboosted and at high risk who should take this disease much more seriously. There are also a whole bunch of people in our state who are vaccinated and boosted and young and at low risk who could stand to take this disease a lot less seriously. And so today, we are here to discuss with all of you the plans that we are making to transition into this steady state model. We will first hear from Lieutenant Governor Henderson as she will discuss our vaccination successes and plans moving forward. Then Nate Checketts, the Executive Director of the Utah Department of Health, will address us. And then we will hear from Dr. Leisha Nolan, the State Epidemiologist at the Utah Department of Health. Lieutenant Governor Henderson.
Thank you, Governor Cox. Now, vaccines have been and will continue to be the surest way to keep us out of this pandemic, to move us into a more steady state. When we talked about moving into this steady state response, our vaccine administration will continue. So that's an important component here. Governor Cox and I are very unified in our desire to get vaccines to as many people as possible. This is an effort that we have undertaken since the very beginning of our administration, and we will continue to do so. That will include vaccinations for children younger than 5 as soon as they're authorized. And we've already made great strides in preparing for this. 79% of the state's healthcare providers who participate in Vaccines for Children program are also now enrolled to administer COVID vaccines. These providers will be critical when it comes to time to vaccinate children under the age of 5 years old. And we will continue to work with the remaining 21% of these providers to convince them to offer COVID vaccines to their patients as well. Vaccines have saved a lot of lives, and they've prevented so much spread since they were introduced just over a year ago. Some people may take issue with this because they were fully vaccinated and still got sick. I was one of those who was fully vaccinated and still got sick. But I also understand that vaccines ensured that while my illness the second time kept me home for a couple of weeks and was difficult, it also kept me out of the hospital. And I didn't, as you can see, I'm not on oxygen this time, as I was for several months after the my first bout of COVID in 2020. We're trying to help you understand that we're dealing with probabilities here. You're more likely to be protected from severe disease if you are vaccinated. Please remember that during the last 2 surges, hospitals were not filling up with vaccinated people. It was unvaccinated people who accounted for the vast majority of hospitalizations and ICU admissions. Now, as far as boosters go, we still have a long way to go to make sure that people are adequately protected. Data show that people who are boosted have significantly more protection than someone who has no protection or has just their initial COVID immunizations. And as we've noted many times, these tools that we have at our disposal don't work if they're not used. So we will continue to be ready to adjust and respond to the needs as cases may go up and down, but we are also making sure that their boosters and vaccines are available to people. We have a lot to be proud of over the last year. In just a year and 2 months, we've administered 4.9 million doses of vaccine. 68.7% of all Utahns have received at least 1 dose of vaccine. We're especially proud of vaccinations that have happened among our multicultural communities. If you remember, we have been focused on making sure that there is an equitable distribution of vaccines into our diverse communities. And as of yesterday, 80.4% of eligible Asians have received at least 1 dose of the vaccine. 64% of eligible Hispanics have received it, at least 1 dose. 75% of eligible Blacks, 71% of eligible Native Hawaiians and Pacific Islanders, 80% of eligible American Indian and Alaskan Natives, and 71% of the eligible white population have received at least 1 dose of the vaccine. Now, vaccines have served us very well and will continue to do so, not only to limit the disease, but also to reduce severe outcomes, limit mutations of the virus and into new variants, and limit the amount of people who need to be hospitalized or pass away from this. So we just need to use them, and we encourage everybody to continue to get vaccinated and boosted as they're eligible. Thank you very much.
Thank you, Governor, Lieutenant Governor. I have the opportunity to talk to you today in more detail about what we're thinking related to our testing processes, related to healthcare, and also related to our treatments. In particular, related to testing, we've had planning related to this and how we wanted to move forward in this process. As we look at the steady state and how we want to have testing as we move into the steady state, we're going to be relying primarily on our healthcare systems. So you think about the other types of testing you traditionally get, that you would be getting those from your doctor's office, your urgent care sites. This is where COVID testing will be going, and this is where it will be happening once we move to this steady state. We also have other types of testing that maybe is very specialized, travel testing, and some of those areas are event testing. Those will be moving to private providers. The state will no longer be playing that role in the steady state model, that would be something that the State Department of Health would be providing or supporting through contracts. Also, as the governor mentioned, at-home testing is now much more readily available. And so if individuals have a desire to test themselves for whatever reason, they have the ability to get those through the pharmacies or grocery stores or other locations. There's a federal program that provides those tests to individuals where you can request those and send 4 of those to your house. Also, health insurance companies also pay for those for privately insured individuals. So there's a lot of different options for members of our community to get this at-home testing. Public health will still have a role in this testing. As always, we are working to help support underserved populations, and we'll continue to find ways to do that, both through at-home testing, and we'll be looking at other models where we can support that. There are certain communities that are at higher risk. We'll continue to help in those areas with long-term care facilities, other congregate facilities like correction facilities. We'll continue to work in those areas. And also, if outbreaks do arise, that's an area that we will still expect that the State Department of Health will still be stepping in to try to help address those, provide additional testing and support those. This transition's already begun. As we brought in, through the Omicron surge, there was a significant amount of testing that was up and available. And some of those that were brought in was related to the CDC. They brought in 2 additional sites for us at the University of Utah and at Utah Valley. Both of those sites will be closing, and that was part of what was planned when they came. They came to help with the surge. The surge was passed, and those were planning to ramp down. In addition, as we work with our contracted testing partners, we'll also be closing sites at BYU, at the Maverick Center, Bluffdale, Laden, and Hiram sites. This is part of our planned rollback as we have less demand. If you've been by our sites recently, they haven't had the lines that we saw a month ago. And so this is part of our ramp down to move towards a more steady state. And it's part of what we'll be doing as we go forward. We'll continue to look at sites. We're still looking to make sure that we have geographic coverage through this ramp down period, but we will be reducing the number of sites we have because there's just simply not the demand right now to require those sites. In addition, as we talk about who should be coming to get testing, we had some discussions about that last month. There's groups that we would continue to recommend get testing, people who would benefit from treatment and need that positive test result. So we would still encourage them to get tested. Older individuals that are still have high-risk conditions, we would still recommend that they get tested. Vulnerable populations and those who work with them. So again, like the healthcare settings, long-term care facilities, congregate living or correction facilities, we would still recommend that they get tested. And people who visit vulnerable individuals, we would also recommend that if that's, as you're making those visits, if you would feel more comfortable doing that, that you go get tested too before you do that. As we ramp down and as we move into the steady state, the state is not stepping completely back from this. We will be prepared if needed to ramp back up. As we've seen over the last 2 years, there's been pauses or quiet periods in the numbers of infections, but we will be ready to move back in if needed. We will retain a core staff that will be ready to do testing from the State Department of Health, and we'll have that in place. We're also going to maintain our contracts with our contracted vendors. So if needed, we can come back and ask them to come back online and be able to help us in that process. We have been establishing a model that we call a kiosk model, which is a lighter staffed version of testing, modeled after some work that Intermountain did and also the University of Utah have been doing in this area, where it's much more lightly staffed. Individuals can get a collection kit, do the collection on their own, and then be able to return that kit. So we're also looking at that as a model, how we might stay engaged and be able to ramp back up quickly if needed. And we'll also make sure that we retain adequate supplies in our warehouse so that if these ramp ups need to occur quickly, that we have those available. Lastly, I will just talk about healthcare and the treatments that have been provided through healthcare. We have been supporting the hospitals with contracts that allow individuals that need to leave hospitals to be able to move into long-term care facilities, into COVID positive facilities. We'll be ramping down those contracts as the numbers in hospitals are finally beginning to move down more recently. But again, we'll retain those contracts in place to be able to use as a ramp up. In addition, related to treatments, the state has, with the press that was on hospitals, the state stepped in and began providing some of these treatments for COVID-19. Again, we'll be moving those back to the healthcare systems. And that they now have the ability, as these medicines become more widely available, and actually as demand has been dropping for them, their ability to be able to provide the antivirals and the monoclonal antibodies will be more adequately matched to their ability to do that. So with that, I'll turn the time over to Dr. Nolan to talk a little bit about how we're looking at data related to this ramp up, ramp down, and steady state. Thank you.
Thank you. So now you've heard how we're going forward into the steady state regarding vaccines, how we're going forward in terms of testing, how we're going forward in terms of treatment. But in addition, we have to go forward thinking about how we're thinking about cases and how we're following these infections as we get to the steady state. And I think it's important for all of us to reset our mind about how we're going to look at things as we go forward, because things are changing. Not only are cases going down, but how we're capturing cases has really changed. And so we need to look at it in a different way. So going forward, we expect we will decrease the amount of times we'll talk to you as the public, as the press, about these cases. We'll probably be reporting more on a weekly basis about what kind of cases are occurring, who's in the hospital, who's died. And we'll be changing our websites to really highlight more the trends instead of the day-to-day individual cases. And that's because that is the need we need as we go into a steady state. We should be thinking as a term, long-term, and a trend instead of every day at one point. But I can say at the Department of Health, we still have good capacity to be able to understand what is happening. We have wastewater surveillance that is really working really well in our state, where we can see are cases having more people shedding the virus, or are they having less, meaning there's more or less spread. So we can look at that. We can look at emergency room visits and clinic visits to see who's going in for care. And that can tell us, are things getting worse? Are they getting better? And we also have that ultimate indicators, hospitalizations and deaths, and we will continue to follow those really closely. So while I say we're not going to look really at cases every day, we're going to continue to have a really good idea of what's happening in the state, so we can understand where we are and what we need to adjust. And also the other thing that's really important is we at the Department of Health are going to keep an eye on what's coming next. We all know there's a possibility that there's new variants coming, and we need to be ready for that. So we have good systems in place to look. We have an excellent system here in Utah that looks at whole genome sequencing of the virus, which allows us to know what is the new virus circulating in our state, is something new coming in. And of course, we're going to be keeping watch of what's happening around the world and really keeping an eye on how different variants are impacting other countries, other states, so that we know what might be coming towards us so that we are ready. So I think throughout this next years, we're going to be keeping an eye on everything, making sure we can respond, we can ramp back up from that steady state if we need to. But for now, we're going to be moving forward with this longer term trend analysis and approaching things instead of on a day-to-day basis, more on a overall pattern. So thank you. Thank
you, Dr. Nolan, for that. I know this is, a definite change for all of us. The case count piece, we've all kind of become addicted to the case counts every day, and that will be changing. I don't know what Ben Winslow or Robert Gerke are going to tweet about every day, but that will be changing as well. As was mentioned by both of them, I think it's important to note that, again, we have to be able to ramp down, and that's what we're doing. And I want to just reemphasize, we're trending towards March 31st, the end of March. So this is a 6-week ramp down, but also that we have the ability to ramp up very quickly as we're stockpiling supplies, so that, and with our surveillance, we'll be able to see what's happening here in the state of Utah, but also what's happening across the globe. What we saw with Omicron, we found out from South Africa what was going to happen. Omicron ended up being the most predictable of all the variants. It acted the very same in every country and in every state. And so we'll be able to see that, whether it's happening here at home or somewhere else, and be able to respond quickly and accordingly. And the last thing I just want to say is this, that as we transition into this ideas of a manageable risk model, a steady state, a personal risk and responsibility model, we have to be okay with the decisions that we make. Every single one of us. You'll notice today that there are several people in this room that are wearing masks. That's okay. There are also people in this room who've chosen not to wear masks. That is also okay. And we all need to be okay with those personal decisions that people are making. I do think that that hopefully there are some positive things that will come out of this. And that is, if you are sick for any reason, whether it's COVID or the flu or just a cold, if you can, please stay home. That's just common courtesy. We don't all want to have your cold or your Omicron or whatever it is that you have. So if you can stay home, do. If you can't stay home, please consider wearing a mask. If you're ill, if you're sick around your colleagues, it's again just a sign of professional responsibility, common courtesy, and kindness to be able to do that, to not spread whatever it is that we're sick with. So I hope that is something positive that will come out of this. I hope that the businesses and organizations across the state will hear what we're hearing from the experts today, and that they'll reconsider some of the restrictions that they have in place right now to allow people to come back. I so appreciate the announcement this week that the Utah Jazz will be ending their requirements for vaccination cards or testing or masks to get into their buildings. Again, leaving that risk assessment up to all of us individually to make. And I would encourage other organizations and businesses across the state to make have those similar discussions and make similar announcements. And finally, I hope that more than anything else, that we can move on from the deeply divided politicization that we've been facing, that we can have an opportunity to come together as fellow Utahns, that we can heal some of those divides, that we can show our love for our fellow citizens, and that we can continue to make Utah an incredible place for everyone who lives here. With that, we have some time for some questions. I'm sure you have a few. Ben, please.
Governor, at this point, so are you declaring that we're into the endemic phase, as the state's been preparing for?
We're heading into that, yes. Endemic, I don't love that word either. I prefer to use, we're treating this as we do every other seasonal respiratory virus. I guess, colds are endemic. I guess the flu's endemic. That's a very technical term that I'm not sure many Utahns process or understand. It also, end sounds maybe worse than pandemic. But certainly we are moving into this phase. And yes, the technical term for that would be an endemic phase.
Then at this point, are you concerned about spiking football, though? I mean, we declared the end game last year, and then we saw a huge surge in cases.
Sure.
Are we just going to repeat this cycle?
Well, we don't know, and that's the key to all of this. That's why you move into this phase that we're talking about, so that you're constantly surveilling. We do anticipate that there will be additional spikes. I mean, I think all of the experts believe that will happen. But again, we see those spikes in other places as well. The question with those spikes are twofold. One, how high will the spike be? And we can see that as it's happening in other places. And two, how deadly are those spikes? We saw for the first time, as predicted, we saw a decoupling with Omicron from the rate of spread of the virus and the deadliness of the virus and the severe hospitalizations that went with that. So those are the things that we have to understand. It's also important to point out that we have a wave of immunity now. Experts have pointed that out, a wave of immunity that we have not had in the past. And there are two reasons for that. The first one is we have so many more people vaccinated and so many more people boosted. So that is providing significant immunity. We also have immunity that comes from the virus, and that is real. We probably haven't talked enough about it, but we have immunity that came from the original virus. We have immunity that came from Alpha. We have immunity that came from Delta, and we have more immunity from Omicron than any other variant of the virus, and probably all of them combined, as it is washed across the country. Red states, blue states, doesn't matter. That has come there. So there are some estimates out there that between natural immunity and vaccinations and boosters, that probably 90% of us have some sort of immunity. Now it wanes over time. We know that. We know that not every case of natural immunity will protect you against the next variant. But again, what are we protecting against? What we care about is we care about keeping people out of the hospital and keeping people from dying. That's what we care the most about. And in Utah, we've done a phenomenal job of that piece. We have the third lowest mortality rate in the country, the third lowest amount of deaths from this virus anywhere in the country. And I hear people say all the time, well, that's just because you're younger. Certainly that's part of it. But even when you adjust for age, we're like sixth lowest in the country. So that doesn't explain all of it. We have had through Omicron, we have been in the top 10 lowest hospitalization rates almost the entire time, as low as 5 or 6 through most of this. So those are good signs for us moving forward. And so no, we are not spiking the football. And by the way, we're not the only state that's going to be making announcements like this. I believe California has already made an announcement like this. Many others are making this. The CDC should be making announcements like this, and we've had those discussions with them. They're very good at kind of skating to where the puck was, but we're hopeful that at some point they'll start to understand it. And I've said this to their face. I said this in Washington D.C. a couple weeks ago, and experts are saying this consistently. They were behind the ball when this all started. You remember we struggled so much early in this because we were the only nation on earth that didn't have a test. The CDC has been a disaster through all of this, and so we're very hopeful that they can change that culture. South Africa, the UK, we're relying on their data, actionable data in the moment, not a month after we needed the data. And so we're hopeful that at the national level we can change to that model. But unfortunately, and maybe it is fortunately, the states have been the leaders in this space from day one, and we will continue to be.
Governor Cox, you referenced California. I understand when they talk about it in crisis mode, they have business capacity restrictions and mask rules. What's the tangible difference for people here in Utah of ending crisis mode and going to this steady state?
Yeah, so the tangible differences are the ones that were talked about here, and that's the way that we will be acting as a state through this next phase. And that is when we will not have mass testing sites open when there's nobody that needs testing, right? We will do that at home. We will be transitioning to a healthcare model so that when you have an illness, you'll go to the doctor. We'll see these tests where you're tested for a panel. So you'll get one test and it will tell you if you have the flu, RSV, or Omicron. Those are the types of tests that we will see start to happen. But you're right. We have already started this phase a long time ago, moving into a personal risk model and having people make those individual choices, whether they want to wear masks, whether they're getting the vaccines, and hopefully they're getting the vaccines. So we've certainly made that transition before some other states.
We're still reporting case counts to the CDC data, so if we present that differently on our dashboard, that's more of a messaging question.
Correct. Yeah. But again, there won't be as many tests to report because, and this, The testing piece is really interesting. If you go back and look, experts last August started calling for moving away from reporting testing the way we've been reporting testing historically. So we do report all of those. Our doctors, when you go and get tested for the flu 5 years ago, those were reported, and so we have always been tracking those flu cases, right? And so that will continue the way it always has. But we have been transitioning. How many of you in this room have taken a home test before? Okay, almost every hand has gone up. How many of you reported that to the state health department or the CDC? None of you reported that. That's why case counts have not been accurate for close to a year now. And they're becoming less accurate all the time. As everyone now has an opportunity, the federal government will send you 4 tests. I would encourage you to do that before you get sick. If you want those tests, get them now. Go ahead and go to the website, fill that out. You'll get those 4 tests. You'll have them for if you do get sick. But that's also very, very different. We don't have home flu tests. We don't have home RSV tests, but now we do have these home COVID tests. So that's always going to make reporting less accurate. Now, fortunately, we are one state that has been using wastewater surveillance. The CDC has recently announced that they're going to expand that across the country. That is a very helpful way to do it. But the best one that we have seen is people reporting to emergency rooms. Because we test all of them, we can see what's happening with the flu. That's a really good surveillance model, and those are showing up as precursors even to some of the other testing that we're doing. Thank you. Other questions?
You noted that businesses can still continue to make decisions based on COVID protocols. The legislature is advancing bills that look at potentially stripping that decision-making authority, especially when it comes to proof of vaccination. How do you feel about that bill, considering it runs counter to your very public statement?
Sure. Well, we talked about this yesterday, and my answer hasn't changed. I again, as we're moving on to this new phase of the pandemic response, as we're moving away from a pandemic response, and most Utahns, most Americans are ready to be done with this. I would love the legislature to be done with this too. I think one of the ways to signal to Utahns that we are done and moving on is to not be running bills that are divisive and be done and moving on as well. And honestly, again, I believe that as I push back on mandates from the federal government, that the market will adjust, and we're seeing that. Again, my hope is that by the end of the legislative session, there are no more businesses that have these restrictions in place. So there's no need for this type of bill. That's what I would prefer to see. And I think that's, again, if you're following the science, as we hear so importantly, that is what the science is telling us, that it's okay. These restrictions, as I mentioned yesterday, if people requiring a vaccination to come into their place or their establishment, that with Omicron especially, that had nothing to do with whether you actually had Omicron or not, or were spreading Omicron. So you could be sick, you could have COVID, you could be spreading COVID, and you could show your vaccination card and get in and spread it to everyone in there. So that doesn't make sense. And I sincerely hope that businesses will recognize that and that they'll open that back up. And that's so important for us healing and coming back together. Okay. Oh, virtual questions. Yeah, please.
We're going with the Deseret News.
Okay, we have a question from the Deseret News. I'm assuming that's Lisa.
Yes.
Okay, we'll see if we can get her on. Sorry, Lisa, we are having some technical
We go with
issues.
Salt Lake Tribune.
Yeah, we're trying the Salt Lake Tribune. See if we can get this to work. I'm sure these were amazing questions, and I'm sure they wanted to know and report on how great we're doing.
Governor, in the meantime,
Go ahead. Yeah.
You made an announcement several weeks ago saying don't get tested. If you have symptoms, just assume you have it. Does that skew what we're seeing now?
Well, it does not, because we have all of these other surveillance techniques to see what's happening, and every one of them shows the same thing, and that's what Nate was mentioning today. But by the way, I didn't say everyone should not get tested, and Nate was very clear about that in his remarks as the director of the Department of Health, that there are certain people that absolutely should get tested. And if you are high risk, you should get tested. If you're working with high risk individuals, you should get tested. Obviously, there are still some travel requirements where you should get tested. And so it does not skew the data. The hospitalizations are dropping. Emergency rooms visits are dropping. Wastewater the indicators in wastewater are dropping everywhere in the state. So that is all very good news. And in fact, because of what we've been able to show over the past 3 weeks, 4 weeks, then it allows us even more confidence to move into this steady state, because we've shown the rest of the nation, and we've had these conversations with other governors and other health officials across the country, that that you can use these other indicators and that they do work. And so there's much more confidence, again, across the nation that we can move to this model. Are we able to get?
I have one question. We cannot get them to.
Okay, and they can put it in the chat, and I'm happy to
What is your
answer.
message for youths who are immunocompromised or otherwise unable to adequately protect themselves from COVID-19 and depend on others to take precautions like wearing masks?
Yeah, so here's the thing, and it's a false question. It's a false dichotomy. It is absolutely false that if you're immunocompromised, you can't protect yourself from COVID-19, and that we have to have every single person in the world protect you from COVID-19. That was true a year ago. That is not true today. I have 2 severely immunocompromised siblings. We have been dealing with immunocompromised situations our entire lives. I have a sister who wears an N95 mask every winter. We were wearing masks before it was cool. There are steps for all of us to protect ourselves. We have boosters. We have medications now. There are so many new medications. In fact, the FDA and the CDC announced a couple more just over the past 2 weeks. These new medications from that will protect people, and they are medications that can be taken ahead of time as a preventative measure, and they are medications that can be taken immediately upon or shortly after testing positive. And so we have all of those tools. And so I completely reject this false notion that every single person in the world has to wear a mask and has to socially distance for the rest of our lives to protect people, because it's just not true. We care deeply about our immunocompromised individuals. And that is why if you see someone wearing a mask, if you see someone wearing an N95 mask, don't mock them. Give them your love and support, because it's very possible that they are going through cancer treatments. It's very possible that they live with someone who is severely immunocompromised. That's why we have to be kind and we have to be respectful of the choices that people make.
Hi, can you hear me now?
I can hear you now.
Okay, I'm sorry, just a second. I was writing my question into the.
Yeah, you weren't prepared for us to hear you, so.
So cases right now, even undercounted, as you point out, are still more than 3 times what they were in July, right before the Delta variant filled up the hospitals, ICU, and the ICUs have been over capacity for like 5 months at this point. Since that time, only like 16% more people are vaccinated now, and they're not as effective as they were at that point unless people are getting boosted, which we know they aren't in Utah generally. So
Actually, lots of people are getting boosted.
well, only 25% or so of Utahns have gotten a booster, and we're getting months, and every day is like more time away from when they first got vaccinated. So I guess what in the data makes us think that the same thing won't happen again, like what happened in August and September, only this time with less warning, since we won't be doing widespread testing?
So again, you have to follow the science. And I know that's really hard for people because the science has changed, but you have to follow the science. And the science is very clear. We're not making this change today. We're making this change by March 31st, okay? Omicron is the most predictable of every variant we have seen. We know what is happening with Omicron. We don't have to guess. We don't have to pretend. We know what's happening because we can see it. We saw what happened in South Africa. We saw what happened in the UK. We saw what happened in New York. We've seen what's happened in every one of these places. And not only that, again, this Go back to October, August of last year, where experts, really smart people with degrees, much better and smarter than me, were saying, stop using case counts. That's not the way to track this virus. We have better ways to do that. And we have them, and we're doing it. So we are not giving up. Utah has one of the best surveillance systems in the country. It has been recognized for a long time. We were doing surveillance on these Omicron variants before many other states, and at a much higher rate. So we know what the new variants are as they're moving throughout our state. Those will continue. We are still doing enough testing, and that testing will continue. It just won't be the state providing that testing. So that testing will continue, and it will be reported. And so we know where this is going. We know where the trends are. And if it doesn't, we have the ability to adjust. This idea that we have to get stuck in some crazy situation forever is very, very unscientific. And quite frankly, I'm very disappointed in the media members that continue to perpetuate that. Instead of understanding, we've seen a huge change in the national media. And I don't know if it's just because blue governors are sounding like red governors now, but there's certainly been a change. But there have been some media, some very few in the state of Utah, that have refused to see what's happening everywhere else and to understand where that is going. And so that's why we're having this press conference, to help convey the importance of how the science has changed on this, how every one of these new tools that we have, there continue to be reports that sound like they're from March of 2 years ago, when that is just certainly not the case. And so I'm sure that that this story will be covered, hopefully with the advice of the experts that we've been given, following the science as it has happened across the country and across the globe, and that we will get this message out to Utahns that we have the ability now to make those decisions individually, to protect ourselves, and to live happily ever after. Thank you so much for your time today. That's all the time that we have for questions. We so appreciate you being here. We wish you the very best. Stay safe, and especially during the last 2 weeks of the session. Take care of yourselves. Thank you.
Okay. I'm Sam, by the way.